Hello and welcome to this episode of the ASHA podcast. I'm Fred Wyant with the American Sexual Health Association, ASHA. And we have a treat for you today, intrepid listeners, as we're talking with Dr. Sue-Lin Hall. She's the author of How to Get Ahead: Secrets to Male Sexual Pleasure from a Female Urologist. And the book goes into a lot more than just technique, okay? Dr. Hall looks at what drives male pleasure on multiple levels, even considering how culture, mental health, and our own personal histories all converge in this wonderful, sometimes chaotic mind body dynamic. So, Dr. Hall, welcome. Thank you so much for your time today.
Thanks for having me. Appreciate it.
It's our pleasure. So, Dr. Sue-Lin Hall, she is a trailblazing urologist, of course, an author, an advocate for holistic wellness. Born and raised in Jamaica, she earned her medical degree from New York Medical College and is board certified by the American Board of Urology as one of the first 50 female urologists in the United States. How about that? Dr. Hall spent decades excelling in a male dominated field. So, let's just jump right in because we've got the one we need to be talking to, I think. All right. So, Dr. Hall, I mentioned in my long winded intro about the brain body dynamic. So, just a little more about that. I mean, how are sex and pleasure linked to our mental and physical well being? How does that mix all come together?
So, sexual health is very important to mental and physical well-being. As a board certified urologist for over 20 years, what can tell you is that my patients all say sexual health is important to them, but no one really has addressed enough about sexual health because some people may feel intimidated talking about it. So I literally wrote this book to get people more engaged with anatomy, binding to intimacy, but in a bold sense of what is it that makes us tick and what is it that can make our lives so much more enjoyable learning about our anatomy or knowing what ourselves need or what our partners need. And so one of the main things sexual health does is that it reduces cortisol. As you know, cortisol is a stress hormone, and that really can cause a lot of many types of diseases in our body. And so by reducing cortisol, we can mitigate the harmful effects of stress on our cardiovascular system, our immune system, and basically our overall health, mental and physical.
Okay. So it sounds like sex is actually good for us beyond the obvious ways. I wanted to ask you too. You mentioned that sex can create a bond between a couple. So how does that work?
When we are excited or stimulated or receiving pleasure, dopamine, the neurotransmitter in our brain that is like a reward system, it's a feedback loop that's a positive reinforcement, is excreted. So is oxytocin, the love hormone, which helps to create bond and trust. And once you have bond or and trust, you can really get to higher levels with your partner. Most people don't realize that being egoless or getting to a higher level of excitement can create another level of happiness within us once shared with someone else that we trust or can bond with.
Yeah. You mentioned something about how your patients will tell you that sexual wellness, sexual health, their sexuality, all of that is important to them, and I think that's a really key point. This sex is not something that's just frivolous, or it's nice if you can have it. I mean, sexual pleasure is something that people prize, and I actually spoke over the weekend at a sex and aging conference, and I shared some survey data with seniors, people 55 plus, talking about their sex lives in their golden years. And not only were a lot of them sexually active, but they really kept stressing that it's important to them, it's meaningful to them, and I think that piece gets overlooked a lot.
It really does. People put it by the wayside. When you're younger, you think, oh, it's just fun. But it really creates a bond between two people. And as we age, we depend on our loved ones. And that includes our spouse, not just children, or as we're aging, we also need love and attention, which really creates this feeling of happiness. As I will say lately, health is wealth. Happiness is the true meaning of life. We're born with joy, and no one should steal our joy. That's our birthright, and we really should share that with others because it really can make your life so much happier.
I love that. It's our birthright. Absolutely.
Yes.
All right. So, one of the chapters in your book is happy endings are spiritual endings. And when I was reading that, I didn't really get a sense that you were talking about in like in a strictly religious sense. You, of course, you mean it much broader, but I want to hear it in your words. So, would you just talk about that? Why is it spiritual?
So it's not spiritual in a religious sense. It is spiritual in emotional, getting beyond yourself in sharing with someone else this happiness or this happy ending. What can happen, as David Data described in his book, is that when you are at that level of emotional wellness that you are experiencing with your partner, some guys, the act of ejaculation is just one part, but being able to enjoy and feel pleasure with your partner can actually go up your spine and get to this nirvana, this feeling of happiness or wellness beyond what you think that act is. It is more of getting to an egoless state, a level of consciousness that you've never reached before. And some people never reach that because they didn't let go of themselves or they weren't able to share that level of trust or bond, or
Mm.
maybe that was broken when they were younger and eventually impacted them. They could never regain that. But if you didn't know, you didn't never experienced that, you don't know what to look for. So, in learning about the anatomy and learning about physiology and how our hormones impact us, because as we age, we go through different levels of hormonal shifts. Women go through menopause, and men go through andropause. We really do go through the same things, but learning what that level that you want to get to is what I try to explain in the book and how to get ahead to get to a level of nirvana by being egoless, by sharing with your partner and really enjoying that person and enjoying yourself.
You mentioned something there that struck me about trust and bond and how those things kind of go together. And and I'm glad you said that, given what we were just talking about. How do couples bond through sex? And I see that does can establish trust, which is essential for bonding.
Right. Very much so. You can love someone and experience pleasure, but it's not until you trust someone that you can let go.
Okay. Um, So let me ask you about some of the old tropes on size and fit. The size of the penis and how snug the vagina should be. We have lots of shoulds in our world when we talk about sex, don't we? So is that all just overblown? I mean, what do you think? How do you counsel your patients about that?
Yeah. So size doesn't really matter. It's the emotional feeling or that you get during the act of intimacy. Size, some people think, oh, wow, they feel insecure if they see someone else in the locker room that looks bigger. But there's actually a girth potential where you may start out small and actually expand beyond the pubis, which is part of the penis is held behind the pubic bone and the other part extends outward. And that growth can actually occur with excitement. And the length or size is a big thing for some men to feel secure or confident, right? But in most women prefer the intimacy that's involved in the act more than the actual size. But it's interesting, right now there's a lot of people going to get fallofill, which is basically how women plump their lips up. Men are getting penile injections for enlargement. And that's more of a confidence booster. I don't think it really enhances their sexual being unless that they feel so much more confident if they feel
Mm.
like they're bigger. But it really is not about that. It's about the enzymes secreted when you're so involved. And for women, our vaginal mucosa expands, thickens with increased blood flow, similar because we have very similar analogous organs. For instance, where our G spot's located is similar to where the prostate's located in a man.
Mhm.
So if something feels good for a man, it may feel good for a woman if each person knows where that spot is. Or as you expand as a woman, your vaginal mucosa expands, the vagina lengthens. That's just for excitement, just like how you can have a baby go through the canal. The sizes change, but it really is more about that intimate bond more than physical size or volume of the vaginal mucosa. Other people may say otherwise, and that may be a mental thing.
Sure. All right. So, well, that segues nicely to my next question. Another chapter of your book is the four P's of providing pleasure. So, I want to ask you about this. And this is not really, I don't, my intention is not to make this a heterocentric conversation. So, I'm really asking this more holistically for anyone who has sex, say, with women. What is your advice on how to give her pleasure?
Yes, so I will write another book. This was more male centric,
Okay.
but our organs are similar. Just like the clitoris is similar to the penis, the nerves run along the clitoris. They run also along the penis, and the four P's, which include pace, pressure, position, and preparation. Because if you don't know where somebody feels more stimulated, you may be doing the wrong thing all these years, and they never really felt that excitement because they didn't know, they weren't prepared for what your anatomy can offer. For instance, in the male, the nerves run along the prostate to the penis. And so when we do prostate surgeries, we make sure we dissect and push the nerves out of the way so that we don't affect erectile function after surgery. Similarly, the nerves for the clitoris run right along the length of what or analogous penis is the clitoris, and so it runs to the head, which stimulates also the elongation or the fullness that develops in the clitoris, just like the penis. When there's excitement, there's increased blood flow, there's increased nerve stimulation. And then where the G spot occurs, which is where the prostate is, learning where that is for position during intercourse. If you are positioned in a part where you're not really touching the G spot, somebody who may be stimulated by vaginal intercourse may not have the same feeling if there's no pressure there. Or you may be having vaginal intercourse and that female may not be stimulated vaginally and may only be stimulated clitorally. And if you're not stimulating the clitoris, she may not be as excited as she can get. So learning those parts of the anatomy can improve pleasure by improving position, pace. Suppose you've been touching somebody with a light feather all the time and they like really firm pressure. You
Mm,
may not have gotten to that, you know, happiness state because we're not doing what that person likes. And that's not the time to ask, not during intercourse, before. So
right,
that
right.
so that's why communication is so key. Communicating what you like, your taste, touch, smell. Somebody may be doing the wrong thing all these years and have not been pleasured for that reason. So that's the preparation part.
There you go. These conversations are so important. All right. So let me ask you the same question for someone who has sex with a partner with a penis. Any tips for them? I know you've got some.
Yes. So where the stimulation is for men, under the head of the penis called the frenulum, where it's the undersurface where the urethra runs, is one of the more sensitive place on a man's organ that the nerves coalesce. And so not necessarily just over the head, but underneath, stimulating that area can be more impactful than say the base. But then at the base, the penis goes beyond the pubic bone towards the scrotum. So putting pressure in the perineum, or where some guys call the taint for women, there's a taint for men behind the scrotum. So this area is very sensitive as well. And not knowing that, you may be losing a little bit that you could enhance this intimate space by stimulating those areas in addition. So you can do more. As I said in the book, it's not for climbing ladders, not for getting promotions using fellatio. It is by learning what your partner likes more and getting into the parts of the body that you may not be aware of that could be even more stimulated.
Great.
Yes.
So, Dr. Hall, let me ask you, within your practice, when you're working with LGBT patients, what's that like? What unique issues do you deal with there?
Some patients are ashamed or uncomfortable with bringing things up. So usually I try to make them comfortable first, create a bond as a patient, make sure that I answer all their questions that they may have because they may not be aware of the changes in the anatomy that develop when even a transitioned person can be very affected by nerves being cut or scar tissue. They may not have the same sensations in certain areas. So I'm very sensitive to bringing up the question if somebody doesn't want to even talk about that. If I know that they're trans and they want to, they may be hesitating asking a question, but in learning that the nerves are changed with transitioning, people can learn that things are going to feel different. They may not be the same sensations they had before surgery. But in people who just change outfits or, are just looking like a woman but didn't do a sexual change, they usually have the same sensations present. But after surgery, we do affect the nerve's root and affect the scarring formation, and that can affect their feelings. So their excitement may be at a different level, not necessarily the same touch or feel, but an emotional level may be enhanced for some transgender people.
Okay.
And it's all individualized.
Okay. And I know your book covers some of these issues as well. So that's why we're going to link to it in the show notes. Okay. Well,
Yeah.
thank you for that. All right. Let's segue to a topic where we spend a lot of our time: sexually transmitted infections, STIs. We know patients often avoid sexual health interactions in general with their healthcare providers, including STI testing, because these topics can be difficult. And you just alluded to that. What would you say to reassure patients who are really just reluctant to bring up these subjects because they feel like they're embarrassed or their provider is going to judge them? I mean, you and your colleagues have pretty much seen or heard it all, right?
Yes, we have. And it's very sensitive. We're dealing with patients' very private areas when we're touching their genitalia or examining them. So, creating a trust as a physician with your patient is one of the key elements in being able for someone to expose their questions, maybe, or expose themselves to you to be able to share the things that they want to understand. For instance, if someone has an STI, they may be ashamed to bring it up. So most times I will address the situation. If someone is early in a relationship, have you been tested? Because you may not know that somebody has a disease process because not all diseases present with a sign. For instance, HIV is not any symptom at all. That's only diagnosed during antigen antibody testing. And if somebody's been exposed and afraid to talk about it, we may do some PEPs, we may do some prophylaxis management. But if they're afraid to tell you about it, you all, as a physician, almost have to ask. Now, in urology, we're so used to people in their vulnerable state that we try to create a bond and make them comfortable enough to ask us. But if they are not asking, you think somebody has, it's our, it's our it's in our interest to really ask somebody if they are worried about something because they may not bring it up at all.
Yeah, and I like that you mentioned trying to create a bond with your patients. We've been talking about bonding a lot in this conversation. We have lots of ways we need to bond and connect with people, and for you to do that proactively, to bring it up if they don't, because you're right, they just may not be comfortable bringing it up. And my next question, you've largely, I think you basically answered. I was just gonna ask, would you touch on why STI testing is so important? even when somebody has no signs or symptoms. And I think we can just summarize that by saying you don't always have signs or symptoms, and even when you do, they can mimic other things. And one person's symptoms may not be exactly like somebody else's. So that's why the testing piece, the counseling piece that you do is so important.
So, for instance, chlamydia is a clear discharge. People may just think, oh, that's just a natural discharge that occurs, and you don't even know that that's really actually something going on. Well, chlamydia can cause scarring in men later if they are untreated. And these treatments are easy, like azithromycin an injection or a pill for 7 days. Really not a very hard management of a real problem that can develop later. Or, for instance, gonorrhea, not necessarily talked about a lot either, but still very common, is a purulent discharge, which somebody may think, oh, I just have more secretions vaginally or through the for men they're a little bit more like, hey, what's this coming out of there? But purulent discharge, for instance, treated with PO cefixime or PO azithromycin for 7 days or a shot of ceftriaxone, very easily treated. But if you don't know, you won't address it. So most people I'll bring up, they will see a lesion, say for herpes, or they may see a lesion for chancroid, which is a painful ulcer that they'll actually come in for because most men don't complain unless they have pain, right? And but
Mm,
if they have a painful vesicular lesion like herpes, then they may come. Now that's one disease that's not really treated. It's not a disease, it's an infectious process, but it it doesn't really go away. We just manage the symptoms, right?
sure.
And to try to help to reduce an exposure to somebody else, because some people don't realize you can actually get contamination without a lesion actually being present, say in the scab phase or in the early phase before the vesicle actually comes to fruition, you may not know. So it's good to look at your partner's organ before you go near it if you don't know this person, because there may be something there. So, for instance, molluscum contagiosum, it looks like a stadium. I always describe it like a stadium in a soccer or a football stadium where
Hmm.
there's a divot in the middle and it's just this raised thing with a divot and you don't even, that just looks like nothing, right? But it may really be something that is contagious and easily treated if you know what you're looking for. So I thought that SDI was a big component to my book in how to get ahead. I wrote a whole section, short snippets to not make the book so you know more of a
Right.
friendly book, but just to make people aware that these things do still exist. We just have to look for them or know
Yeah.
what to look for.
Right.
Yes.
So we'll bottom line it. So your 30-second elevator pitch. So somebody's watching this. They're like, yeah, I've got something that's worrying me. I think I'd like to get some testing done. I just can't. How do we empower that person? Say, look here, this is what you do.
Yes. So the first thing is if it's a male to see a urologist or somebody even a family practice physician who is aware of these disease processes to actually investigate and look further. For HIV, if you think that you've been exposed, there are prophylaxis exposure medications available, PEP. There are three retroviral medications. Some are non nucleoside reverse transcriptase inhibitors, which is just such a long word, like tenofovir. These are medications that we can given for set 28 days if you think you've been exposed, but you're not sure, to prevent you from getting a disease process, for instance. Or if you're a female and you go to the gynecologist, we usually go to gynecologists more than men will go to urologists because we've gone all along. So many times it will get picked up in a pap smear, or we may get picked up on just a visual examination. But for men, it's sometimes hidden and underreported. So I really like to make patients bring up something that they may be insecure about to come and have it evaluated. It's really not such a big deal because disease processes can be prevented if known ahead of time.
And I'll say again, you and your colleagues have seen and heard it all, right?
Yes, we have. Fortunately or unfortunately.
Yeah. All right. So Sometimes we think of safer sex in terms of birth control rather than STI prevention. And I'm curious, when patients use a method that's highly effective against pregnancy, say they've had a vasectomy or their partner's on the pill, do you ever talk to them about also using condoms for STI prevention going
Yeah.
forward?
Yes. Many people just think about birth control pills as a way to prevent pregnancy, but what about all the other STIs that are around there that you may not know someone has because some of them are not easily seen or obvious to
Mhm.
the vision or anything else? And so it's very important for young people, especially if they're not in a monogamous relationship, to be tested or before going into a monogamous relationship to make sure you're coming to the table also, you know, also safe. It's good to test by a blood test for HIV, by a physical exam by a physician for a female or a male before starting it. But also using a condom is very easy in preventing most physically contagious disease processes. Say a condom breaks, though, then you're still exposed, right? So learning ahead of time would be always best.
Okay. And we have a lot of tips on our website about how one uses a condom
Yes.
correctly and lubes and all kind of things so that hopefully they won't break. So check that out too.
Awesome.
All
There are some lubrications that have a higher impact on the fragmentation of the condom. You guys also present that information, right?
we do.
Yes, that's great.
Yeah, thank
Yeah.
you. All right. We've been talking with Dr. Sulin Hall, author of How to Get Ahead: Secrets to Male Sexual Pleasure from a Female Urologist. We will link to her website in the show notes, as well as a link to get her books. You can get yourself a copy, which I think is a great idea. Dr. Hall, it's been a delight to have you on today. Thank you so much for your time.
Thank you very much as well. At Quantum Health and Wellness Center, I really want to expose people to health and happiness. And the book is How to Get Ahead, does that for me. Appreciate you.
Well, we appreciate you. And thank you, intrepid listener, for joining us. As always, keep in touch. We're at info@ashasexualhealth.org. Send along any comments or topics you'd like us to cover, and we'll see you next time. Bye for now.